My name is Steve Power. I'm the Senior Project Manager here at Musgrove Park Hospital. I joined the hospital in 2008 primarily to help manage the construction of the new wards building in which we're sitting now. The wards building has been a long-standing aspiration of the hospital. The actual project has probably been more than a decade in the making. Its primary function is to replace the old Nightingale wards that were constructed as part of the World War II hospital. So the building we're sitting in now has got 112 bedrooms, and the crucial difference is they've all got ensuite bathrooms. Whereas the old Nightingale wards, they were open plan and you had a number of patients sharing the sanitary facilities. There are other upgrades we've made within the Jubilee building to make this building fit for 21st century healthcare. There are a number of advantages that we saw to using a two-stage open book tendering process. The first was working with a number of contractors during the stage one tender. So whoever was successful at that point had a very good understanding of what our project was and what was important to us as a client during the detailed design and delivery phase. Also during the delivery phase of the project, as I've said, we worked very closely with our contracting team to make sure the project was delivered safely. And also there were some financial benefits, which of course are important to every client. The fixed overhead and profit rates were very attractive to us, whilst recognising that from a commercial perspective, the contractors were entitled to make a profit as well. So we like to think that we got a lot out of using the two-stage tendering, but so did the contractors. The Jubilee building is the first phase of a two-phase project. The second phase being replacing our theatres and critical care facilities, which are also housed primarily in the old World War II hospital. We are currently working on that project. We're trying to arrange the funding for it, and as soon as we're able to, we want to carry out the project and complete the overall two-phase project. The project ran very smoothly from start to finish. And what attracted us to using the framework was the two-stage tendering process that one goes through, and the ability then to work with a contractor in conjunction with the design team to not only complete the design phase but work in detail through the construction phase of the project to iron out any potential problems that may arise. In particular, we enjoyed working with our contractor to plan the construction phase of it. This is an operational hospital. We're a busy district general hospital providing acute services to around 230,000 people in West Somerset. And we need to keep delivering those services day in, day out, regardless of any construction activity on site. So it was really important for us that we nailed the construction phase plan and how we were going to deliver this building without disrupting any of the other clinical services that we provide here. We worked with our contractor, in particular constructing a mock-up room, which was a separate building to the wards building, in which we tested out the design and buildability of the single bedrooms and ensuite bathrooms. Our thinking was, if we made a mistake in one of the bedrooms, we'd be replicating that mistake 112 times through the whole building. But it also gave the contractor the opportunity to build the bedrooms and ensuite bathrooms and understand some of the construction detailing that the architects were trying to achieve as well. We have to deliver projects in collaboration with the wider construction and design team. That's the only way projects happen. I've been involved in projects over the years where that kind of sense of team working hasn't been as good as it could have been, and the projects haven't turned out as well as they might. And I think also importantly, the people involved in the projects didn't get as much out of it personally. So collaboration is very important to us, and we know that from delivering healthcare here. This hospital has been running for more than 60 years, and we know that in order to deliver good healthcare, we have to work as teams. Teams working closely with the patient, but the wider team supporting our clinicians. And we carry that same ethos through into our construction projects. Yes, we worked with the framework management team to understand how the contractors that formed the framework had performed on other projects. And that was one of the other attractive features of the construction framework, was the benchmarking, not only in terms of cost, which of course to any client is very important, but also in terms of quality. And we understood that the framework heavily featured the quality of the finished product, in that no more than 50% of the scoring marks when you're assessing tenders can be attributed to cost. So they really sought to balance the quality finished product with value for money. As part of the design brief for the project, we included a section about the sourcing of products, materials and labour to build the final building. And we set up a stepped approach to it, where wherever we could, we wanted to involve local labour, local suppliers, local materials, and then that gradually widened out to a county-wide focus, and then to the South West region, and then to the UK and so on. To try and make sure that we, wherever we can, minimise the carbon footprint not only of the building in use, but during its construction as well, and also support our local supply chains. There was a particular feature of the building that we wanted to incorporate, and it was to do with how our staff communicated with each other on a day-to-day basis. And one has to bear in mind that we were moving our staff and our patients from open-plan Nightingale wards into a much more cellular ward building with individual bedrooms with ensuite bathrooms. Whereas in the Nightingale wards, our staff may be able to look across the ward, see all of their patients and their team members. In the Jubilee building, that's not always possible because of the cellular nature. But we wanted our staff to know that help and support was at hand. And to facilitate that, we partnered with a company called Visera, and they provided us with the communication system. And I'm wearing an example of that around my neck now. This small white badge is the wireless communication device that all our staff use. But in order to achieve the deployment of this within the Jubilee building, we had to work very closely with our contractor. They had to allow our IT teams on site to do a full Wi-Fi survey of the building, whilst they were still heavily involved in the construction phase. They set out to us their requirements for health and safety and how our staff needed to behave on site. We trained our staff using the construction skills certification scheme, so they could operate autonomously on site under the contractor's supervision. That allowed us to fully deploy the communication system supported by a comprehensive Wi-Fi network without any hitches at all. So when we came to the opening day, when we moved our patients in, the communication system was fully working, and that could only have been achieved by working very closely with our contractor.